This is Drrodrohrich. Welcome back to Rohrich Knows Podcast, helping you become a better you. Well, today we're going to talk about a combination that actually is becoming more and more common in my practice. In fact, about a third of my facelifts, I do combination rhinoplasty and facelift. And I've had a lot of DMs on my social media recently since I've posted a couple of patients that had that done, and they said, wow, we didn't know you could do that. Because often we'll do combination things with a facelift. You know, eyelid surgery, a lip lift, perioral laser. But as you know, when the aging of the face occurs, so does the aging of the nose. Our nose gets longer, it starts drooping, and so it's an incredible aesthetic package because you can lift and fill and do a deep layer facelift, and you can do a rhinoplasty. Now, both are highly sophisticated procedures. So let's go through it. I'm just going to share with you at a recent patient I did this on, and then I'll go through what I did and how I did it. And so let's just roll with it and just show you the possibilities. 7 weeks.
Neck. Yeah, the neck too. Yeah. Thank you.
Yeah, she's got beautiful, beautiful shape in front of her cheeks. Her jawline is fantastic.
She looks amazing.
Straight. So got a little swelling, but
I think it's fantastic. I'm so excited. And I even tell people I've had it done, and they're like, when? We're like, yeah, about 6 weeks.
Yeah, look at her jawline. It's pristine. It's unbelievable. All right, so you saw her, you heard her. You can see how transformational it is. And here she is pre-op, and here she is like 7 weeks post-op. You can see it's a beautiful, natural, deep layer facelift with central facial fat augmentation, eyelid surgery, and jawline enhancement, and a rhinoplasty. And, you know, those are the things that actually look good because they look very natural. She looks just youthful. She just looks 10 years younger. And I think that's the beauty of doing combination surgery with facelift. You know, because you can see she's got such elegant jawline shaping, malar shaping, as well as her nose. Now, her nose obviously takes longer to shape. It takes longer to see the final result because it'll take up to a year, 12 to 15 months to see the final shape and contour of her nose. And that's the one thing about rhinoplasty, that it just takes a lot longer. Now, the facelift, you can see even at 6 weeks, you know, her shape and contour is amazing because you can see the shape of her jawline, her cheeks, and you can see that beautiful shape of her malar area, and she just looks youthful. And I think the beauty of bringing this up is that so many patients that DM me say, I didn't know that was possible. Now, granted, I'm a rhinoplasty and a facelift expert. That's why I do these in combination. So if you're not, you know, comfortable doing a rhinoplasty and a facelift together, then I think it's something that you should probably stage. And, you know, the combination of doing this takes about 5.5 to 6 hours because I've done the face, the eyes, and I've done selective facial fat grafting, and then I'll do the rhinoplasty last. And in this case, you know, we just reshaped her dorsum, took her dorsum down, reshaped it, refined her nasal tip. She's going to have a little super tip break there. Beautiful jawline shaping. You can barely see her incision anymore because we've hit it in that area. It's beautiful. And I think that's the key element here, is shaping and really getting you a natural looking result. And that's really what you want. You want a natural looking result, and you want a combination that says, wow, this is amazing. And it's like she said, people just say, hey, you look great. What did you do? Did you do something different with your hair? And I think that's great. That's the sign of natural and great facial rejuvenation. And a rhinoplasty is that people don't know. You know, the worst thing you can do is say, oh, you've had a facelift, and I think that's just devastating. So age-appropriate correction of your eyes, your face, your neck, and your nose is all in one package. It's the duo or the trio, and I think that's the magic of doing this together. Now, granted, these are highly sophisticated procedures, so the key is, know before you go. Make sure you select a board-certified plastic surgeon or facial plastic surgeon that is an expert in both of these arenas, in the science of aging, the correction of facial aging, facial rejuvenation, and of course, rhinoplasty. And rhinoplasty is by far the most complicated procedure we do in all of aesthetic surgery. And you can see that it's shaping and contouring and giving you the shape and contour that you want. But so is facial aging correction. You can see the jowls are gone and her aging has been corrected, and it just gives her that fast forward look of youthfulness. And you could see it and hear it in her voice that is really what she wanted. And I think so many patients, the analogy to this is also, often when I'm doing a rhinoplasty and a facelift, I'll do hand fat augmentation as well. And we've talked about that separately before, but I'm going to talk about it again in an upcoming episode of hand rejuvenation. It's really a sign of aging as well. So the take-home message here is, when you're analyzing the face, and when somebody comes to me and says, Dr. Rohrich, what can I do to not look so tired? Well, as you know, everybody always looks at your eyes, your nose, and your lips. When you look at somebody, that's why when people come in and say, I just want my neck done, I say, okay, we can do that, but you're going to come back and say, I still look tired. So you need to consider doing your eyes, because that's the first thing you look at. And then you look at your nose, and you look at your lips. So all of these are in harmony with each other. And then the brows, if they need to be done. And I think that's why you need to go see a facial aging expert, somebody that understands the science of aging, and also that's not going to do crazy stuff and doesn't do, foxtail lifts and all this crazy nomenclature which makes no sense, but does things that make sense and look good, and do computer imaging to show you what it can look like, and then execute it and do it well, and do it so that it looks natural and long-term looks good. So I think those are the most important things. And the reason I'm talking about this is because so many of my patients have DM'd me and talked to me about saying, wow, this is something of a game changer. And it really is a game changer for this patient, because she looks incredible. And I think that's really what you want to do. She looks subtly incredible, and she's of course beautiful before, and she's now been enhanced. And I think that's the beauty of doing combination surgery. So know before you go, select the surgeon that can do these things and has the experience, the expertise to do so, and can show you the exceptional results, the three things, 3 E's, experience, expertise, and exceptional results. So please give me your comments, give me your thoughts and DMs, and I'm happy to share with you other combination procedures that I do very commonly with a facelift, because facelift and facial rejuvenation is so much more than just a facelift. So, helping you become a better you. So until next time, stay safe, stay very knowledgeable, and let me know any questions you have for Rohrich Knows.